here from my new quarantine bunker. I appreciate all the good wishes I've heard from all of you. Look, I tested negative on Friday, tested negative today. It's one place where being negative is better than being positive. And we did this out of an abundance of caution. My friend Max Reese, who's still a bundle of kinetic energy, is going strong. So we're going to be good. But we look out for each other. It's sort of like a band of brothers and sisters in the governor's office. And when one person tests positive, we err on the side of caution. Something I urge all of you to do as well. We're here just for old time's sake with Deirdre, Josh, and Paul, and a special guest I'll have an opportunity to introduce you to in just a minute. But first, Max, let's do the COVID Daily Summary. This is 3 days worth of numbers. I think what you see is our COVID cases are ramping up, headed towards probably 100,000 cases by the end of this week. We continue to do a ton of tests, probably more tests than just about any state in the country. The positivity rate continues to creep up. You see 5.4%. We'll talk about that in a minute. Again, hospitalizations is the number that we're looking at carefully. And this is a number that you'll see is continuing to go up, and you'll see what that means in terms of other states. And it's going to be a key metric as we figure out what we do going forward. And 22 fatalities over the last 3 days, sort of our average of 7 or 8. But it's just a reminder, Deirdre reminds me that we're going to be talking a lot about therapies. We're talking about vaccines. We're talking about ways that we do this. But sometimes we can lull ourselves into a false sense of security that the crowd is younger, we're getting it earlier, less to worry about. Not true. The fatalities are still with us. We have to watch this very carefully going forward. Let me show you just a couple of the nationwide headlines because they tell a bit of a story about what's going on in the rest of the country and what we're doing everything we can to avoid here in the Northeast. First of all, we talk about hospitalizations. Back in April and May, as I've said before, COVID was more regionalized. It was regional to the greater New York metro area and southern Connecticut early on. Now, as you know, as you can see from the background of that map, that it's really nationwide, and there are very few places that aren't hit. So we have to learn to manage our hospitals ourselves. We won't be able to borrow from one part of the state for another, or one part of the country for another. And you see healthcare workers are tapped out amid the surge, says Wisconsin, which is going through a big hit. Doctors are calling it quits under stress. So I think it's going to be less about beds, less about PPE, less about vents for sure, and more about making sure we can keep our doctors and nurses energized with enough backup, enough support that we can manage what could be the surge going forward. And we're working on that right now. Josh can tell you about it in a few minutes. North Dakota governor changes tack and issues a mask mandate. This is a big deal. That I just got off one of the last of the Vice President Pence COVID task force, and they overwhelmingly said, let there be no ambiguity how important it is that you wear the mask in any situation where you could be at risk, or anybody around you could be at risk, and you must wear it indoors. Even in North Dakota, even the task force in the White House are all on one page here now. I'm not going to read you that El Paso headline. That's just too depressing. Let's go to the next page. This shows you sort of on a week-by-week basis that our testing positivity is tracking hospitalizations. And a hospitalization or positivity is obviously a leading indicator for hospitalizations. I think I told you why it's so important that we try and bend the curve, yet again, that old phrase, in order to protect our hospitals, in this case, protect our hospital staff. Okay, we're at 5-6%. You can see that on the daily positivity. I was just on with a lot of our regional governors. Pennsylvania's at 20%. South Dakota's at 58% positivity. So this is what we're trying to avoid in any way we can here in Connecticut and here in the Northeast. As you see, as we add on, more and more hospitalizations, we have about 757 today. Remember, back in the bad old days in April and May, we got up to 2,000 hospitalizations. So we still have plenty of capacity, less demand upon our ICU, we hope. The ability to add on field hospitals, but it's still a key metric because of the people that we're focused on. And we got together with all of our regional governors, yesterday via Zoom. And clearly, we're going to come out with metrics that focus on hospitalizations in terms of what we do next going forward. I think unlike last time, we all agreed that this time it's not a matter of a lockdown. It's not a matter of a shutdown. It's a matter of a tailored response. I mean, we all agreed that we're able to keep retail open safely as long as we keep our distance, avoid any overcrowding, and wearing the mask. That's important as you have Black Friday and Thanksgiving coming up. We've had, all of us agreed, had pretty good fortune in the workplace. Although now it's better if you can telecommute from home, like I'm doing today, do so. That is safer. But again, we haven't seen any real spread there. Again, all the governors were agreed that just like in Europe, that schools are not a source of spread, especially at the lower grades. So we're going to be issuing guidance on that very soon. But we also see what happens if this thing does become more of a hockey stick. We did in terms of Massachusetts and Connecticut led about 2 weeks ago by saying a 9:30 last call, 10 o'clock lights out at the restaurant. And all of our neighboring governors are doing the same thing. We're going to be looking at gyms. We're going to be looking at indoor dining. We'll be looking at churches if we have to going forward. Those are areas where you maybe have a little more likelihood of spread as opposed to a retail and workplace. Let's go to the next chart. One thing all the governors agreed to is this is a period of great risk coming up because of Thanksgiving, because of the holiday season. And we are issuing a strong declaration. Paul's taking the lead, working with other chiefs of staff as regards Thanksgiving and as regards colleges and as regards we sending out-of-state college kids back home and out-of-state colleges sending their kids back home. And we're going to be very clear on what we got to do. And it worked when they came back to school, back to UConn in September. One, a 14-day quarantine, either before you leave or after you come back. Two, get tested. Get tested so that when you land, we can tell that you've been tested. And more importantly, Josh reminds me, almost all of you don't land in an airplane. Most of you come by car. And it's the same protocols I got to hold. And we can't enforce this. I'm going to have to depend upon your good judgment to make sure, and your parents' good judgment, your family's good judgment, that you follow the protocols, you follow the quarantine, and you follow the testing. It's so important. We're sending that out to all the colleges around the country so they know exactly what all the governors in our region believe to be important. Sorry about the parties or reunions. I think that goes without saying. And again, for the elderly, those most at risk, keep your distance, wear your mask, tell your grandparents from a distance how much you love them. That's really important in terms of their safety and our community's safety. And finally, I just wanted to show you what we're doing on track and trace. And this is the app that we described just less than a week ago. It's the Apple, Google, Android app, and it's been extraordinary. And I really want to thank the people of Connecticut. 600,000 people have already signed on via the settings on Apple and also on 600,000 people on a purely anonymous basis. If you were in contact with somebody who tested positive, we'll tell you on an anonymous basis that you've got to quarantine or track and trace to help us out. And you can see compared to Pennsylvania and New York on a percentage basis, we've got almost 20% of our people who have done this. And obviously, the more people that sign on to this app, the better it is for each and every one of us in terms of keeping us safe. With that, I just got off with the Vice President Pence's task force. It's a group we've gotten to know each better, and they're more forceful and more helpful, I think. Dr. Birch, Dr. Fauci, Pete Gaynor from FEMA, a lot of enthusiasm, not just about the Pfizer vaccine, which we've discussed at great length, but Moderna, which made their announcement in the last 24 hours. Again, very high effectiveness going forward. Rolling this out on a very cautious basis, starting in about a month to 6 weeks. You know, focusing on nursing homes where we're going to work with Walgreens and CVS and others, working with our hospitals so our frontline responders get access to this. And this is going to take months. So that's why what we can do to bend the curve now is the bridge to the vaccine that will make an enormous, enormous difference. So that's the outgoing Pence task force, and they're going to, we've now got the Biden task force, which is coming in. And I hope there's a smooth transition there. And I'm really pleased to be able to introduce Marcela Nunez-Smith. Marcela was a member of our Reopen Committee. She's a professor at Yale. I'm sure Joe Biden thought that was important, but he loved the fact that she was on the Connecticut Reopen Committee when it came to why she should be co-chairperson of the task force being led by the incoming administration. You know, for us, she really took the lead on communities. And what that means is, look, we know that COVID has had a disproportionate impact on people who are Black and brown and underserved communities. We know how important it is when it comes to testing and therapies and vaccine, that all of our communities, including the underserved, get their fair shot at this to make sure each and every one of us is safe. And Marcella, I'd just love if you could talk a little bit about what's going on to date with the Biden task force and some of your priorities.
Great. Thank you so much for the invitation to join today, Governor. So, you know, as you mentioned, I'm very focused on emphasizing the importance of equity in all the work that we're doing, as is the full advisory board. Our board is working very closely with the transition policy teams. These teams have been in place for some time, mapping out transition plans. And so now we're here to help turn those plans into an action blueprint that can be really ready to go in January on day one of the new administration. I think important to note that the work of the transition is driven by data, by evidence, by science. We know that there will be differential impact on frontline and essential workers as as we dial up and dial down on openings. And that reality really does guide our thinking and our planning. Our planning work is also guided by our understanding, as you mentioned, of the differential impact of COVID-19 and other groups, those who live and work in congregate settings, such as nursing homes and prisons. We know communities of color especially have been very hard hit by the pandemic. And so to that point, the board is thinking about how we optimize equity and efficiency across all of these areas. So whether that be in testing, in contact tracing, providing supports as needed, such as food or housing during quarantine and isolation, in access to the treatments we see coming on board, and of course, in vaccine distribution. It's a real honor to be here because at our core, we are committed to listening to and learning from states and local municipalities, tribal communities, community leaders, and others to really best inform how this transition plan becomes a successful implementation blueprint. And so the lessons that we learn here in a leading state such as Connecticut are going to be invaluable, really, as we try to think about how the federal government can be of the greatest assistance. So we do have some causes for hope. I mean, we have bleak statistics, as you've shown us, Governor, but we know now more than we did in the spring, for sure, about treatment, about what works to limit spread. And we have news of vaccines that are promising and new therapies on the horizon. We have great gratitude to all of the scientific teams leading that work. But we know that full scale up and distribution, many months away, we will need to sort of double down on what we know to be the first principles when it comes to masking consistently and keeping that tight social bubble. So it really is important to emphasize what we can do now, particularly with the holiday at the fore, and not let our guard down in any way. I mean, the best thing is, as you said, to keep our current social bubbles in place and really not to expand them for the holidays. As the students are returning home, especially if you're unable to quarantine somewhere else, it's important to wear that mask inside if there is somebody in the house who is at risk. And just to reiterate that our most precious and valuable resource right now is our healthcare system. And by that, I don't mean the buildings, I mean the folks on the front lines, those doctors, those nurses, the respiratory therapists, who are tired and who are making great sacrifice for all of us. It's important that the resource be there for those who need them. So please, 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 I beseech you to continue to do all that you've been doing, to wear your mask, to keep your social bubbles tight. We will emerge on the other end of this. So I'm really grateful to be here, to thank everyone in person for everything you're doing. And thank you, of course, Governor and the entire administration here in Connecticut for keeping us safe.
All right. Well, thanks, Marcella. You'll get to know Deirdre Gifford, who's very well. She's leading our vaccine advisory board. And Paul and Josh are on board as well for any of your questions.
News 8.
So, Dr. Nunez-Smith, explain to me, have you got to meet or talk to President-elect Biden, and how does his approach forward mask what Governor or mimic what Governor Lamont's task force is doing? In other words, what can you bring to the table from this task force to his?
Great. Thank you so much for the question. You know, the president-elect has made very clear that this is a top priority for him coming in January, addressing and getting ahead of COVID-19. And as I said on the advisory board, we certainly are looking to learn from states that have been leaders in this pandemic. In Connecticut, I think I'm very grateful that I'm a resident of the state. We're very early on. The response was guided by science and evidence. And those are the same principles that the president-elect is following. And so, you know, we take a posture that there's a lot to learn from states such as ours, and that we can be really quite intentional about thinking of how to support and complement already strong work that's ongoing in the states.
NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. On Friday, President Trump suggested that states that are doing their own review of the vaccine development process might face some delays in terms of distribution. How do you respond to that? Will the state's review slow down the vaccine distribution in Connecticut?
No, I don't think so, Matt. What we are trying to do is give people confidence that when the vaccine is ready to go, it is safe and effective. And Deirdre's advisory board includes members of the community, including ministers and legislators and labor leaders, as well as scientists who can go into the community and give people confidence that when it's ready, it's time to go. And these vaccines are being released under strict FDA approval process, as well as CDC. But do you agree with that, Marcella?
100%. I'm very grateful for you to say that, because I know that the issue of vaccine uptake and confidence is one that is on a lot of people's minds. And absolutely, that is the approach that we would be recommending, is that very close partnered work with community leaders and others, and the reassurance around the safety, really, that it is going through, all the vaccine candidates are going through the same steps in terms of safety and efficacy. Agreed.
And Governor, just going back to what you were saying in terms of looking at gyms and indoor dining, what metrics are you considering when you are looking at those, and what are the possible options that you might take in terms of further restrictions?
No plans at this time. We just put in place our 2.1 a couple of weeks ago. But I think hospitalizations, and we discussed with all the governors that we'd like to have a kind of a clear set of metrics, although it'll be different state by state, but people understand what we're doing and why we're doing it if we have to make some changes going forward.
Channel 3 Eyewitness News.
Yes, a question for Dr. Nunez-Smith. You know, the Trump administration on Friday said that there would be no national lockdown under his administration. But if Joe Biden were president at this point in November, would you be encouraging one? And do you foresee one next year when he actually takes office?
Yeah, thank you for the question. You know, I think that the president-elect has been very clear and I think consistent in recognizing the need for precision, right? I mean, you know, as I sort of said before in the remarks, there will be dials up and there will be dials down, and that will depend a lot on sort of local conditions. You know, your question was directly at would I be advising him currently for a national lockdown? And I think one of the things that's great is the president-elect is surrounding himself with advisors who have different opinions, and that we can all give our different perspectives. I tend to very much agree with the notion of precision, and that we can, in fact, when we sort of focus on task, keep in mind safety and economic recovery. We have to carry both. So my answer is it's got to be a precise adjustment of the dial up and down. It's not a light switch.
Thank you. And a question for the governor. You know, we're talking about the criteria for college students returning home needing to test negative before and after arriving. Should this apply to all travelers to our state? And what will enforcement look like?
Well, for aviation, for people flying in, first of all, which is not the majority of students, as I talked about, but a lot of other people, Thanksgiving is a heavy travel season, although it's a good time to stay home. I think we're going to have a clear declaration from all the governors about this, and a clear declaration that we want you to get tested. I want to see a negative test when you land. In terms of enforcement, you know, as you know, right now at Bradley Airport, we also have a testing facility there. So if you don't have that, we can get you tested right then and there, but you do have to quarantine until we get that negative result for you.
Fox 61.
Good afternoon, Dr. Nunez-Smith. This is Tony Terzi. Quick question for Dr. Nunez-Smith. Dr. Tom Balsasak said last week that based on research, it was his belief that, and researchers' belief that there would be a peak in this virus sometime around the end of the year. Can you expound upon that, and what is your position on that?
Thank you so much for the question. And Dr. Balchazek is a very good colleague, and it gives me a moment to say extra thank you to all of my colleagues, Yale New Haven system, who are doing so much right now. So absolutely, I think the numbers that he shared, there is concern about sort of a peak. What I think we can do is not take that as inevitable, right? That we will see this rapid increase. And again, hospitalizations is a rate that we pay attention to. We each have the power to change that projection. And it is through those, what I think of as simple acts that honor our healthcare workers and honor our neighbors by wearing a mask consistently, wearing them the appropriate way, right? So remembering to cover your nose and your mouth. Again, inside, outside, it is not in lieu of social distancing. So you still also have to maintain the social distance and protect your bubble. And that is how we disrupt those projections.
And for you, Governor Lamont, first, hope you're feeling well. I wanted to ask you more about gyms and restaurants. Do you have a number in mind in terms of hospitalizations reached that might trigger some more restrictions on those businesses?
Not yet, Tony. And it is something I'd like to do along with my fellow governors. We all have very close in terms of hospitalizations, and it obviously makes more sense if we had to ever do something with restaurants, so we do it alongside Massachusetts and New York. But we're not there yet.
News 12 Connecticut.
Hi, Dr. Nunez-Smith. You mentioned that, it's not inevitable that we have a rapid rise in cases if people do simple things like wearing a mask. Would you recommend, or is President-elect Biden considering a nationwide mask mandate?
Thank you for your question. I mean, the president-elect has said on multiple occasions that he would like to see us get to that place where we, in effect, have national agreement and unification and adherence to mask wearing standards, and wants to work with mayors and governors and other leaders on that front.
Governor, I want to ask you real quick, now that you've had a negative test today and another one, I guess you said on Thursday, are you planning on getting tested again this week? And if so, how long would you plan to stay in quarantine?
I plan to get tested on my regular basis, which is Thursday. Maybe I do it again sooner, just to, double check that, I'm not carrying the virus in any way. And I'll stay close to home for the, immediate future. That's for sure.
So would that be the rest of this week, or?
At least for the rest of this week. Ostensibly, it's 14 days, but we'll see what the nature of the infection is then.
And Governor, one last question for you. Just some clarity on the college testing plan. Are you suggesting that we follow New York's lead here and test students before they can even leave?
Yes.
And I would like to just go further. The Department of Public Health sent out guidance to Connecticut universities and colleges on Thursday. While we are having conversations with our regional partners about having a more regional response, the state of Connecticut definitely was out in front on this one. And I thank Dr. DJ Gifford, and her team at the Department of Public Health in getting that guidance out to those universities and colleges in the state of Connecticut.
All right. Thanks, everybody.
Thanks, John.
WTIC 1080 News.
Hi, Dr. Nunez-Smith, on the outgoing administration withholding cooperation with your group, is that a lot of hype, or is that actually going to have a negative effect on your team moving in on January 20th?
So thank you for the question. I apologize, it was a little bit choppy in my end to hear. I think you might have been asking about communications with the current administration regarding the transition.
And cooperation, yeah.
And cooperation. I mean, so we remain very optimistic that we will be able to work with the current administration. It is certainly, we're still working, we're still planning as the advisory board, advising the transition planning teams, absolutely. But so far, we have not had an opportunity to talk to, sort of even the career folks in the administration who really have valuable information and insights. And so it hasn't happened yet, but we're very open to that. We would appreciate a chance to work together.
Before I ask the governor my question, are you being blocked from contacting folks in the Trump administration?
I think Marcel is too nice. I mean, I think it's really urgent that this transition begin on a constructive basis. And I really urge the Trump administration to open the doors. I've talked to a number of people on their COVID task force, and I think they're ready to participate. Look, come January, we're going to be in the middle of the vaccine distribution. And some requires 100-degree sub-zero refrigeration. Others require different metrics. Some are going to different depots. And you're handing the baton over right in the middle of this process. So the degree to which we can plan together now will make it much more effective on January 20th.
And the National Guard funding, which you're asking an extension to the end of June next year, what are the signals you're getting from this White House? And is that something that might have to wait for January 20th?
Oh, we'll see. But look, the Guard have been absolutely vital. You know what they've done in terms of track and trace. You know what they've done in terms of field hospitals. We're ramping up again in this state and 49 other states. So it really would behoove the federal government to be clear that we're going to get more support for our National Guard, at least between now and January 20th, when the new team can set the direction.
Thank you.
The Associated Press.
Dr. Nunez-Smith, could you talk about what you feel is absolutely necessary that your team know before the transition is complete, before January 20th? Is it the distribution plan? What do you need to find out from this current administration and the Vice President's team?
Thank you for the question. I have a long wish list. I mean, it certainly does include the issues you raise around the vaccine and the distribution. As the governor outlined, this is just taking the vaccine question alone raises a lot of operational, logistical questions regarding supply chain and cold storage and many other things. We know that there are people who are very thoughtful and smart and creative who are in the current administration who are working on this now and finding solutions. So that is, one of many things that it would just be in everybody's best interest if we were to sync as teams in this process.
Governor Lamont, can you talk about, you said that the hospitalizations are the most concerning thing. Are you working now on re-ramping up field hospitals, putting in more capacity in Connecticut? Where does that stand, and is that being worked on a regional basis?
I'll start, and then maybe Josh can help me out with this. But look, we found we can get those field hospitals up in 48, 72 hours. So I think we're going to move on that when we got to move on that. We know we've got some capacity there. I think hospitals, in terms of people power, nurses and docs, they're going to maybe have to make some choices about elective surgery as time goes on going forward. Those are some of the priorities. But Josh, do you want to add to that?
That's exactly right, Governor. Commissioner Gifford and I are in regular conversation with the hospital leaders about their capacity. We are on standby to support, expansion of some of those field surge capacity hospitals if and when needed. But as the governor said multiple times in this press conference, I think the biggest concern right now is the people, our nurses, our doctors, our professionals in the hospital system who've been working so hard for so long. And who, are really just doing amazing work. And it's on us to do all the things that the governor said, that Dr. Nunez-Smith said, to help take the burden off of them by following the rules, keeping our masks on, being safe this holiday season, to help protect those hospital workers who've been doing such an amazing job.
And finally, Governor, have you been talking with the state or regional casinos about any changes to their plans and when they would need to change plans?
Yeah, Paul's been leading those discussions. As you know, Mohegan Sun has followed at least our phase 2.1 by saying their restaurants are going to shut down at 9:30, which is, I think, a really important step in terms of getting everybody on this level playing field.
Paul, any other changes?
Yeah, I would say that as the governor stated, we thank Mohegan Sun and Mohegan Tribe, who took actions not only through their tribal council, but also through their casino operations to follow the 2.1 guidelines put forth by the governor. We're always going to have continual conversations with both of the tribes individually as it deals with being as much aligned with the state of Connecticut and the region when it comes to public health and safety, and as it deals with their overall casino operations. What we're seeing right now is the states around us, as they have gone down to a similar 2.1 model, also included casino operations within it. So while the two tribes are both sovereign nations and we treat them as such, we will still continue to have aggressive conversations with them, keeping public health and safety for the people of Connecticut and the region as top priority.
Thank you very much.
CT News Junkie.
Thanks, Max. Governor, what is our 7-day rolling average at this point?
What is that, Josh?
It's 5.6.
Thank you. And Governor, you were speaking earlier about being able to sort of keep the retailers open at this point and looking more at maybe restaurants and gyms and that sort of thing. I was just wondering, and maybe we've been over this before, but what is the capacity limits for, like, let's say a Target or a grocery store? Being out and about this weekend didn't seem like there was anyone keeping track of capacity in some of these bigger stores.
Well, let me. I've heard that there are some isolated issues where there's really overcrowding and there's some hoarding going on at grocery stores and maybe some other retail. And this is really important. The only way we can keep them open is if they maintain that 6-foot distancing outside, if you have to wait to get in there, and make sure that everybody is wearing the mask inside that facility. Otherwise, we're not going to be able to keep these open. But do they have like a capacity limit like the restaurants do? You know, the restaurants are sort of capped at 50%. Is there a number attached to these grocery stores? I think it's the fire capacity limit, 50%, but I've got to double check on that unless one of you guys know. Does anybody know, Josh? Is that the case?
That's correct.
Okay. Yeah. And Josh, maybe you would know this. When was the last time the hospitalizations were at this point?
I believe it was about the third week of May.
Okay. All right. Thank you, everybody.
Thank you.
The Day of New London.
Hi, Governor. Julia Bergman. Also have a question about your request today to extend the National Guard support. If the federal government denies to continue paying the pay and benefits for those 400 Guard members, would that support have to stop? You indicated in your letter that the state doesn't have the ability to fund that current level of support on its own.
I don't think so, Julie. I mean, what they're doing is absolutely vital. And I described the various functions they do in helping us keep this pandemic under control. It should be a federal responsibility, but if they're not going to step up, we'll have to.
Yeah, the one great thing that General Yvonne and the whole team, Connecticut's team of the Connecticut National Guard has done is truly stepped up throughout this whole crisis. The letter that the governor put forth that is going to be supported by the Connecticut congressional delegation, and we thank them for that support as well, is to allow us to be able to fully respond to this COVID-related crisis here in our state. As the governor has stated, and it was full in that letter, not only from delivery of PPE, putting up filled hospitals in record time, been able to send them down to do emergency testing as soon as yesterday. We did that in Norwalk. General Yvonne and his team have truly stepped up. And as the governor said, this is truly a need for a federal response. And we hope and we look forward to the federal government supporting the request put forth by the state of Connecticut.
Thank you, guys. And then I just have one more question. It's for Commissioner Gifford. Late last week, Steve Mansfield with the Ledge-Lite Health District said that the district is no longer tracking and reporting case numbers independent of the state report that's coming out because of the workload associated with an increase in cases. Are you hearing from health districts that they're overburdened, and does that worry you at all as far as being able to quickly identify outbreaks in local communities or regions like we saw in southeastern Connecticut?
Yeah, so we are in really continuous communication with our local health districts about their needs around contact tracing. And the system that Josh set up long before I became commissioner with the team at DPH really has been able to scale up to support those local districts when they reach their capacity. So a couple of things we're doing. One is, that we've distributed some additional funding to local health districts, and Steve Mansfield and Ledge-Lite have gotten some of that funding so that they could hire additional tracers. But more importantly, the statewide contact tracing system that we have allows us to shift back and forth between our statewide pool of full-time contact tracers and the local health district. So when a district raises their hand and says, we're having trouble keeping up, we pick that up and we start doing the contact tracing. As of last week, we were able to reach out to 98% of contacts, 98% of cases that got into our system within 48 hours of them, their notification reaching us. So we are still keeping up. We're still hiring. We're hiring Connecticut residents to do contact tracing. We're hiring individuals to be outreach specialists from the hardest hit communities. And we're working really closely with our local health departments to make sure that we share the burden with them on the contact tracing.
The Waterbury Republican American.
Thanks very much. Do we have a breakdown of the number of cases per day over the weekend, or is it just that single total?
Just the single total, Paul.
We're getting a lot of questions about enforcement. I know we've discussed this many times, but just today someone sent us a photo of a wedding. It looks like it was held at a private home in Middlebury. And judging from the size of the tent, if there were 10 people attending that wedding, they were superly socially distant. So could you go over again, who should people contact when they see either a blatant or a suspected violation of the coronavirus restrictions? And also, what happens, what should they do if they report it to the local or state police, local health department, or a local fire marshal, and the report is ignored?
Want that, Josh?
Sure. So the first line of defense for enforcement is your local police departments, local law enforcement, and your local health department. And you should immediately reach out to either or both of those. They work together hand in glove in your communities. They have a number of tools to deal with violations like that, ranging from breaking the event up to issuing fines to arresting people and closing establishments if there are blatant violations. And our local law enforcement and local health departments have been doing all of the above. But you're right, Paul, we are continuing to see some cases like that are violating the rules. And frankly, that's why we are where we are right now with these numbers. And so we really are looking for support from our partners locally to step up the enforcement, but most importantly, looking for our neighbors here in Connecticut to follow the rules and recognize how serious the situation is right now and help us bend the curve and get through this winter to the vaccine period.
And maybe the governor and Commissioner Gifford could comment on this. You bring up a good question, a good point about enforcement. It's local enforcement. So if it's not a priority locally, there's not going to be any local enforcement. And also, if there's not enough people in a health department to do SNAP inspections or a fire marshal's office to go out to every restaurant and bar in the community to make sure they're following their capacity limit, can you sort of help frame what's a reasonable expectation for enforcement?
I'll take a shot. You answered the question in part by asking it, which was you have heard from multiple people in that community that there was a violation going on. So I'm really thankful that folks are looking out for each other, looking out for the community public health when they see a real violation like that. And that's how we find out about, a vast majority of these violations. Josh is right. We hope that the local public health, local municipal officials, local police can deal with it as needed. We also have state police who can step in as well.
Commissioner Gifford?
Yes, I will add. I want to build on something that Dr. Nunez-Smith said, which is the relationship between our own personal actions here and protecting our workforce. And it can be a little bit hard to make the connection between attending a large wedding or a large party or an event and the overworked and potentially ill healthcare worker. But that is exactly the relationship that we hope people will keep in mind as they think about maybe ignoring some of these rules. We have nursing assistants in nursing homes and nurses and doctors on the front lines in Connecticut who have been dealing with this pandemic for months now, and they are exhausted. And we really need to think about them as we go about our daily lives and think about helping them, protecting them. We all have a role in doing that. And it's looking out for them that is, I hope people will keep in mind as they consider whether or not they're going to put on that mask or go to that party. Those things do translate into infections, and those infections do translate into hospitalizations. They translate into cases in the nursing home. And so whenever we can think about protecting and taking care of our workforce, I hope that will inspire people a little bit to follow the rules.
Connecticut Public Media. The Hartford Courant.
Hi. So, Governor, in the last few days, in Washington State, where they actually have fewer cases and hospitalizations per capita than we have here, they've announced that they're closing indoor dining and they're closing gyms. Michigan is closing down indoor dining. The city of Philadelphia is taking steps along those lines. Even bordering states or nearby states, New York and New Jersey, have less capacity for indoor dining, less capacity for gyms currently than we have. So I'm just wondering what your calculus is right now around these issues that's different from what these other leaders in other places are dealing with.
Well, we just took the lead on rolling back to phase 2.1, establishing the 9:30 last serve. We did that with Massachusetts. I'm really pleased that New York and New Jersey and Rhode Island have followed on. I can't speak for Pennsylvania off the top of my head. Those biggest states like Pennsylvania and New York do things more on a county or regional basis than smaller states where we do them on a statewide basis. But you've just described some other options that will be on the table if we cannot bend this curve.
So I guess, what do you say to people who look at the numbers, which are going up not only here but everywhere and seem to almost inevitably be continuing upward, and they say, if we don't do something aggressive right now, that will be more people who are hospitalized and maybe more people who die?
Well, I think we want to do things that work. We've realized, as Marcella said, it's not a light switch on or off. I mean, let's face it, New Jersey has a very high infection rate. As you point out, they have, maybe 25% of the people are allowed in their restaurants, so there's not necessarily a direct correlation between some of these issues. We're trying to do things that work, make a difference in bending the curve, do what we can to allow our kids to continue to have the social and emotional learning going forward, and to not totally discontinue our economy in a dramatic way. But we lead with public health. And if we find we have to do more to bend the curve, we'll do it.
So you've talked about kind of keeping up with New York and New Jersey. So is there a specific reason why they have stricter capacity restrictions for indoor dining and for gyms than Connecticut has?
Well, remember, in parts of New York City is 25%, and parts of all abutting us is 50%. They're more or less similar to what we are on that front. Gyms, we're at 9:30 p.m. I can't speak to exactly what time that is. But these are incremental changes. I think, Alex, what's most important is what we do going forward. I think we're going to try and do boldly on a regional basis if we have to.
And then last thing real quick, I'm just wondering if Paul and Josh have been tested for COVID in the last few days, and if you're willing to share your results.
Yeah, tested negative last Thursday, and was tested again today, and presumably get the results tomorrow.
Sorry, I missed the question, unfortunately.
I was just wondering if you've been tested for COVID in the last few days and whether you've gotten any results.
I have had taken the usual test that we take on a Thursday, and taken a test on Saturday, and have taken the test also today, with all of it being negative, waiting the test for Monday.
Got it. Thank you, everybody.
Hearst, Connecticut Media.
Hi, Max. Thanks. Governor, has anyone else in your staff tested positive?
Not that I know of, Ken.
No.
Thanks. And Does anybody regret the logistics from Friday at the hospital? People seemed jammed together. There were some complaints about that. Is that a lesson to be learned going forward?
Look, I think there's some truth to that, Ken. Look, it was obviously an incredibly important moving time at a hospital where there was a shocking fatality of 2 people in the front line. That said, there was a lot of people, more people than I'd anticipated, that were in there, expressing their condolences of what it meant for Connecticut. And I think we will be, I'll be more careful going forward.
I just one clarification also, Ken, just also everyone, while I was not there, it has been reported to me that people were wearing face shields and masks. People were appropriately distant. There were people in terms of chairs that were spaced out. Yes, it was indoors dealing with a very tragic situation. But one of the things that we will continue to do going forward is evaluate all of those related decisions going forward.
Thanks, Paul. And Governor, is there anything else we should be expecting from the regional governors to decide on? It seems like the returning college kids is the main thing.
The travel advisory, we've agreed that we're going to send out strong guidance in terms of schools, in particular K-8 education. So each of the local jurisdictions don't get too far ahead of us there. And we're thinking broadly about what next steps and metrics might be along the lines of the previous question.
And Governor, are you planning on a bond commission meeting before the end of the year, going back to like actual state business?
Yeah, what do you think about that, Paul?
As of right now, we are planning to have one before the end of the year. As you know, things can change, and we can have a meeting canceled, we can have a special meeting, but right now that is on the agenda and the horizon at this time. Stay tuned.
Thanks. And finally, Dr. Nunez-Smith, could I ask you your opinion? I mean, it seems like you've kind of said it, but I'd like to clarify it a little bit more about how Connecticut is responding to the need of underserved communities in the pandemic here that's reflaring.
So thank you so much for the question, Ken. I can start, and then I'll turn it over to Commissioner Gifford, probably. I mean, I think what's really important, and one of the lessons from Connecticut that we're bringing to the federal work is that, from the beginning of the reopen work, it was really remarkable to stand up a committee and a team to think specifically about groups that are at risk. That is not something that universally happened across the country in reopen. And it's to Connecticut's, I think, credit that the focus was there early on, and really equal, if not higher priority than other issues. And I know that there have been, since the spring, a lot that's been done and a lot that's in place specific around our most at-risk populations. So I'll ask the Commissioner to please add.
Yeah, thank you. And I want to acknowledge Dr. Nunez-Smith's leadership on the Reopen Committee. She really helped us lay the framework for including issues of equity in all of our work on the public health and pandemic response. We're at DPH and at DSS and across the government, we're continuing to listen to communities that are disproportionately affected. We're hearing, things about testing, for example. We've gotten feedback. Try to make sure that testing is accessible and at appropriate hours for people who don't have flexibility in their jobs. Make sure that you are giving access in multiple languages. Make sure you're providing reassurance about payment so that people aren't afraid if they don't have insurance to come and get tested or seek other services. So we're continuing to listen and hear and try to respond. And every day the teams are working to incorporate those suggestions into our work.
Thank you very much. Thanks, Max.
And that was the final question. Final word, Governor Lamont.
I guess the final word is, Marcella, you're doing us proud. You were invaluable for us during the reopen, and now you're co-chairperson of the committee for the incoming administration. I'm really proud that you were there, and I want you to know Connecticut's there to support you in any way we can. We're so lucky to have a friend there in the commission. Thank you so much, everybody. Be safe.